Turn your camera off until your time.
We're live.
Good afternoon, everyone, and welcome in. We'll just give it a few minutes while we still have participants joining. Good afternoon. Happy Wednesday. Good afternoon, everyone. As you're coming in, we're just going to wait a few minutes to begin to give all of our providers an opportunity to join. Thank you all so much for joining this afternoon. Good afternoon, providers. As you're coming in, welcome. Thank you so much for joining us. We're just going to give it a few minutes so that we can be sure that those that wanted to join can join. Good afternoon and welcome all. Thank you so much for joining. For those that are just coming in, we are going to start momentarily, just trying to give all of our providers an opportunity to join. All right, I do still see the numbers jumping, so we do have lots of providers joining. Welcome in. Awesome. Okay, I think we're going to go ahead and get started. This session is being recorded, of course, so if you do or want to watch it later, that option will be available, but not to prolong your time. I think we'll go ahead and we will get started. So good afternoon and welcome to our CAPS Provider Relations informational session. My name is Letitia Lewis, and I am the interim manager for our Provider Relations Provider Support Team. We have been listening to your questions and your concerns, and in response, we've created this webinar session. In this session, we're going to be able to provide answers to your most frequently asked questions. Due to what we need to cover today, and I did see someone already ask this, we will not have a question and answer session. Instead, we are asking that you utilize the chat to ask questions, and then we will offer a survey at the end of the webinar that will allow you to ask any additional questions that you may have later. There will be a link provided in the chat at the end of the webinar, and we will also send that link for the survey in a follow-up email. And again, welcome and thank you all for joining. Next slide. Again, my name is Letitia Lewis, and we're just going to go over our project overview. So starting November the 15th, DeKalb took over the provider management function of the Child Care and Parent Services Program, a task that was previously handled by our contractor, Maximus. We implemented these changes to offer more streamlined and effective services to childcare providers who play a critical or crucial role in supporting parents and children. A major component of offering more streamlined and effective services is our brand new system, Georgia CAPS. Next slide. On our agenda today, we will go over project overview, tickets and top priorities, demonstrations and how-tos, best practices, training and support, and then contact us. Our provider relations team is made up of 4 teams that will be assisting you. Each of these teams has been working really hard to provide assistance via the phones, your email inquiries, and completing your applications renewals, and so much more. Later on in the session, you will get to meet the managers for each of these wonderful teams. The teams are as follows: enrollment services, provider support, quality assurance and payments, and education outreach. On our next slide, I will give you an overview of how each of these teams will be assisting you. All right, so our provider support team, again, this is the team that I am currently managing. They serve as the point of contact for all provider inquiries. They support the providers with billing, payment, and scholarship issues, and connect the providers with resources to resolve issues. Our enrollment services team enrolls new providers, completes annual renewals, transfers change of ownerships, reviews all rate increases. Our quality assurance and payments team will receive and review provider invoices for payments, ensure payments are timely, oversee and complete quality assurance processes to support accurate payments. Our education and outreach team will conduct outreach to providers to promote CAPS participation. They will facilitate provider orientations and ongoing training, and they will offer technical assistance to enhance provider success, as well as develop resource material for providers. Again, thank you so much for joining, and this is just a brief overview of how our teams are going to assist you.
Okay, thank you, Letitia. Okay, there we go. So good morning again, or actually good afternoon. Losing track of time today. So thank you for being here. And my name is Kay Mayfield, and I am the director, the CAPS Provider Relations Director. And we, as with any system implementation, we expect that, we're going to have some problems and some, kind of getting used to the system and just having to make some corrections. So we are working hard as possible to get those issues corrected. And just to let you know that any issues that are impacting provider payments, we prioritize those issues for resolution. We have a team that works on them. And as soon as those issues are resolved, those are implemented into the system right away. So due to some of these issues that you've encountered, we've received some calls and tickets from you. To support your inquiries, we are going to be adding 6 new members to our team next week to help with triaging and responding to your inquiries. So we are trying to work through your inquiries as quickly as possible. We've advised our team to work through those inquiries from the earliest, the ones that were reported the earliest, to the latest. This is a new team, and we're still honing our skills, but we're committed to providing support and honing those skills to respond to you timely. But we do ask that if you have an issue and we ask that you allow us 48 hours to respond to your inquiry before leaving a second callback or submitting another ticket. And this will help us be able to focus on resolving your issues rather than going through, some of the duplicate tasks that we've received. But today we are going to discuss the most commonly reported issues, and we're going to talk about the status of those resolutions and any workarounds that we have in place for you to until that issue is permanently fixed. So next slide. Okay, so first, the first issue I'm going to talk about today is user account setup in Georgia CAPS. So in preparation for the transition of the provider management and payments functions from Maximus to Decal, we asked all providers to update their user accounts that were issued to the organization and the Maximus provider billing application. And we needed this updated information to be able to establish users in the new system, the Georgia Child Care Administrative and Payment System, or what we're calling Georgia CAPS. So for the first 2 weeks in October, if you logged into the Maximus PBA, you would have seen a notice to update your users. So for providers who logged into the PBA and made those updates, we identified some data that was not compatible with the user setup in Georgia CAPS. For example, we noted that the same person had multiple email addresses. But in Georgia CAPS, your email address is your username. And so only one of those email addresses was activated for one person under a single taxpayer identification number. So if you haven't received your welcome email, please look at all of the email boxes that you formerly used with Maximus, because in Maximus, they only allowed, they would allow multiple email addresses for a user, but that's not the case in Georgia CAPS. So please look at all the email addresses that you formerly used to determine which email address was activated in Georgia CAPS. And we can also, if you can't find it, of course, you can always call our CAPS provider support and we can let you know which email address was actually activated. Next slide. So the second issue we identified with the user data that we received from Maximus, which isn't compatible with the Georgia CAPS user setup, is that one email address was provided for multiple people. So in Georgia CAPS, because your email address is a unique identifier that associates a person with that username, and that's a security reason for that. In Georgia CAPS, only one person was activated under the email address that was provided. So if someone on your team did not get activated, because again, we have an email address and we have one person associated with that email address. So if there was somebody else that you put under that same email address, that person didn't get activated, but you can add that user with a different email address in Georgia CAPS. So to add a user, you can submit a ticket or you can call our provider support team. If you call in, though, you will be asked for your taxpayer identification number, which is also called your employer identification number. And that is so that we can verify that you're authorized from the facility to make those kinds of changes. So this is sort of a new practice for providers, but that's the reason we're asking for it, is really for security reasons. Next slide. So lastly, we also are aware that there were about 200 providers who were not activated in Georgia CAPS because they didn't log into the Maximus provider billing application during that 2-week time frame in October when we were asking you to update your user information. Because those folks didn't log in, we didn't have, again, if we didn't have your email address, your first name, your last name, and we also needed the role within the position. When that information wasn't updated and we didn't have the complete information, particularly the first name and last name associated with the email address, we just weren't able to set that user up in Georgia CAPS. And so we were able to identify who those providers were, and our education and outreach team has attempted to contact all of those providers to get them set up. So hopefully if you're one of those, you've gotten a call from our education outreach team. However, if you haven't got the call and you haven't received an email, a welcome email, and you're still not able to access the system, if you haven't already contacted us about that issue, please do, and we will get you activated. Okay, next slide. So some providers are reporting that they are getting an error when trying to log in using the link provided in their welcome email. The link on the welcome email actually expires. It expires after 7 days. And so we would ask that, if it's been 7 days, don't go back to that particular email and use that link. You should use the URL that you see here in the slide. If you can bookmark it, or put it somewhere that you always can go back and select it, we suggest that you do that. If you forget it, you don't have a bookmark, you can always go to the CAHPS Provider Relations webpage to get the link. So just remember, don't go back to that welcome email. It expires. You might have trouble using that link. So use the link here. Okay, next slide. Okay, another ticket we received is that certain providers are having trouble logging into Georgia CAHPS due to username errors. So we want to let you know that for technical reasons, our IT team needed to add the plus sign and Georgia decal before the @ sign. And so that added to your username or your email is your username that you would use to log into the system. So for example, if your email is littlelovinghands@gmail.com, you would need to add the plus Georgia decal after Little Loving Hands and before the @ sign. That is your username. Now that's something we want to try to do a little bit differently in the future. We really just want it to be your email address, but there were some technical things that, there was nothing we could do anything about. So until we can rectify that, just remember you'll have to add that. And we're hoping we can change that in the future. Next slide. So some providers have also reported that they must change their password every time they log in. Our IT team thinks that this is maybe because providers are going to the link in the welcome email. And as I mentioned earlier, the link in the welcome email expires after 7 days. So again, please don't go to that welcome email using that link. Use the link that we provided in the earlier slide. But if you receive this error and you're not going to the welcome email link, if you're getting this error just by clicking on the URL that we provided, then please submit a ticket. And if you would note in the comments that you are actually using the URL, not the welcome email, that will help us be able to triage and figure out the root cause of this particular problem. So I'm going to turn it over now to Sarah.
Hello, happy Wednesday. So I'm going to be talking about scholarships and rates. I know we've had some reports from providers about missing scholarships. So we did a system fix over the Thanksgiving holiday and the weekend of December 2nd. And scholarships should now be displaying as of December 4th. There is an exception to this. The week a scholarship begins, it will not be visible to the provider until 5 p.m. on that Monday. So, for example, if you have a full-time scholarship issued for a week-long school holiday, like December 25th through the 29th, that scholarship will not display until 5 p.m. on December 25th. So if you are still not seeing scholarships, if you're not seeing all of them, then you will need to submit a ticket in Georgia CAHPS and we'll, get that issue rectified. All right, next slide. Okay, so another error that we were seeing in Georgia CAPS was providers were seeing scholarships marked as expiring when they shouldn't be expiring. So some providers have reported that they were expiring when they shouldn't be. You should see expiring scholarships in the expiring scholarship tile. What should display in this tile are the scholarships for families where the certification period is ending in the next 60 days. However, we became aware of the scholarships displaying for other reasons. So to prevent any further confusion, we've hidden this expiring scholarship tile in the Georgia CAPS system. So when that issue is fixed, we will display the tile again. All right, next slide. So we are aware that providers are seeing duplicate scholarships within the system. Some providers have reported that they are seeing duplicates, 2 scholarships for 1 child. So we came up with a temporary solution to help work around this error. So you obviously would want to bill on 1 child. For the duplicate scholarship, mark the child as not attending and only bill for 1 of those scholarships for the child. Otherwise, if you bill on both, it may result in an overpayment. And then for those duplicate scholarships that you're seeing, we would need you to log a ticket in Georgia CAPS so that way we can fix that error. All right, next slide. So some providers have reported they would like a rate increase or that their rates are not correct for what you're seeing in the system. If you recall, in 2021, we received federal money at the Access Initiative in response to the pandemic and created several emergency payment policies. At that time, we asked all providers what their full published rate was. And to that, we added, I'm sorry, I lost track, because funding was support paying the provider their full published rate, and that was limited. And we had to forecast what our ability would be to make the payments through the Access Initiative. A consistent rate was necessary. That means that throughout Access, we are not able to increase provider rates except for the structured rate increases that we have applied and that we will apply. So if you recall, in October of 2022, there was a 7.87 increase applied to your published rate. And then in January of 2024, there will be an additional 4.3% increase to your published rate. So if you feel that your rate that you're seeing in the Georgia CAPS system is not reflective of either the rate you provided in May of 2021, along with the 7.87% increase, you can log a ticket for that. But if you are updating your rates for your private paid children, the rates that we have for your CAPS children will not align. And then, as we mentioned earlier, through the Access Initiative, we are not able to approve providers' published rate increases. So therefore, any request entered in the system for a rate increase will be removed. At this point, you should no longer have the ability to choose that option in Georgia CAPS, and it will remain there through the Access Initiative. Now, 2 types of higher rate increases that we will process will be the evening and night care rates or the children with disabilities under the rate request change section in Georgia CAPS. So you can submit those. All right, I'm going to turn it over to Alicia Golden.
Good afternoon, everyone. My name is Alicia Golden. Some of you I may have met and others not, but I am the Quality Assurance and Payments Manager for Provider Relations, and I'm excited to be here with you today. And as you guessed it, we are going to talk about payments. So I know that's a burning topic and there's a lot of questions related to payments, and I hope that we're able to give you some answers and kind of help give some guidance as far as it relates to our payment and our new payment processing cycle. So first off, I want to start off with some issues that have been reported regarding payments. First is the visibility to submit the attendance record. So we have reports that providers are encountering the submit button when they're trying to submit the attendance for the service week. In Georgia CAPS, providers can enter their attendance daily and save the attendance record for the child. But you should be aware that simply saving the attendance records does not submit the invoice. Okay, please go to the next slide. Because most providers are open Monday through Friday, we built Georgia CAPS to allow most providers to bill on the weekend, Saturday and Sunday, and therefore, but the submit button for attendance is not available until 5 p.m. on Friday. So if you're in your current service week, you can enter attendance daily, but the submit button option in the bottom right corner will not be visible until 5 p.m. on Friday. Therefore, if you have saved attendance only, you need to go back in and make sure you hit that submit button so that your payment will be processed and received in the payment cycle. There are also some issues that providers are reporting not being able to see the payment amount. This issue has been resolved as of November 22nd. Providers can view their payment amount under the remittance section in the portal once the invoice has been processed for payment. Then, how to view your payment. Some providers have asked for assistance in viewing their payments. To review your payment, you have to go to the remittance statement in the left-hand menu in the portal. In this screen, you'll see the payment amount issued and the date it was paid. If you drill down into the remittance statements, you will see multiple service weeks if you submitted more than one. And then, of course, you will be able to see the invoice details. Just remember that the remittance may have multiple invoices, but there will always be one invoice per service week submission. And then on the next slide, this is just showing you after you've drilled down into the remittance statement where you'll actually see the invoice number, and then you would be able to further drill down into see the payment details per invoice. Okay, now we're going to discuss things that you should be aware of and how to navigate the system as it relates to billing and payments. All right, first big topic is COVID billing. So as we know, there can be a lot of confusion around the COVID billing, and it's associated with our emergency policy waiver that's still in effect. So there are a couple of things that I wanted to remind you of as it relates to this policy and claimant COVID billing. So requirements to be able to bill a child is that the child must be enrolled in the CAPS program, and there must be an active scholarship that can be billed on after the child has been present in that child care center at least once. And then, of course, your center must have been open or in care if you're attempting to select COVID billing. I'm sorry, 1 second. All right, so let me go to the next slide about the COVID billing criteria when you should not bill for COVID. All right, you should not be billing for COVID if you know that the child is no longer enrolled in attending your facility, or the child is attending another facility, or the child never attended your facility, or there's a duplicate scholarship and you're attempting to bill COVID for the duplicate scholarship and attendance on the other. So the key here is remembering, right, to be able to bill COVID for this child, it is a temporary absence for that service week. However, at the point that the provider knows that the child is no longer enrolled or attending their facility, then is when they should not be billing for COVID. Okay. Just keep that in mind. That's going to be important because you don't want it to cause overpayments. And then, of course, if you know that the child is no longer enrolled and you still have an active scholarship, then please report that with CAPS, and we'll have someone check into that and update the scholarship if necessary. All right, on the next slide, we have had some reports, and we're well aware of that the COVID button option is not visible for all providers. And we have reports that that's not showing. For some children it is, and some it's not. We have reported this issue. We actually hope that it is going to be deployed and corrected this week. So we hope that that functionality will be available soon for you all that are experiencing this technical issue. And then I know that it looks a little different than how it did in Maximus for billing for COVID. But one thing is that it's going to be different than you did before is that you're actually marking that no, the child was not in attendance, because that's what the COVID billing would be for, right? The child was not present this week. No, the child was not in attendance. Then the COVID option button should be visible to you as the provider, and you would check COVID and hit the save button. You will not have to enter or select any attendance days to be able to do that. Now, we will notify you, or you should be able to see an update from us once this feature has been corrected. And then after that, if you're still experiencing any issues with this button not being available to you, then please submit a ticket. One thing too, I wanted to keep in mind about this, and another reason you may not see this button, if you have a scholarship for a child that has actually never attended your center, the system knows that and also will not show you the COVID option if the child has never attended your center and been present at least once. Okay, so on the next slide, this is about requesting that your request changes that can be submitted in our system. So one of those is, like we talked about on the slide before, is that if the child is no longer enrolled, typically providers historically had to call or send an email, but there is a request change feature on the left-hand side in the portal, and there is an option to report that the child no longer attends the facility. You can submit that request, and then we would, of course, contact the family, reach out to them, determine if that scholarship needs to be expired or changed. And so we just want to make sure that you guys are aware that there are these features available to you in that request change section if there's something that you need to report or update. Another great feature about our request change is that the submitted requests are also available to you as the provider. If you submit one of those requests, you would actually see that request under the submitted request tab, and you can see what type of request it was, when you submitted it, and the status of that request, whether it's pending, it's been approved, it's been returned for revisions. You would be able to see full transparency as that is updated between you and our staff. So just want to make sure you guys are aware of that. And those request change features can be things like updating your banking information, reporting temporary closure, reporting that the child's no longer enrolled in the facility, things like that. So you'll be able to actually see those requests that you have submitted. Okay, the next topic we want to talk about is holding slots. There may be situations when a child does not attend the child care program because the facility goes on vacation or for other reasons. In accordance with our CAPS policy, we will authorize a payment to a provider in situations if it is documented in the provider's policy manual and the child has been present at least once prior to billing for the holding slot. So a couple of things to keep in mind here is that we will only pay for a holding slot up to 2 weeks if there is an extended absence from the child care program. Okay. And this has to be specifically stated in your policy, and we would update our system to reflect that. So a good example would be Thanksgiving break, right? The child was not present during Thanksgiving for the entire week. If you have holding slot in your policy, then you would be able to select the child no was not present and select the holding slot button, and you would receive payment based on the holding slot. The only caveat is that it's limited to 2 weeks during a child's absence. So you cannot bill and receive payment greater than 2 weeks for holding slots. And then of course, if it's not in your policy, then you would not have that option available to you in our system. Okay. Next topic is on virtual care. There are some changes as it relates to virtual care. So we wanted to make sure that you guys were aware of that and knew how to bill for virtual care. Virtual care is only for school-age children with variable scheduled scholarships or a standalone part-time scholarship. When school is in session and a virtual learning day has been designated by the school system. Providers should select virtual billing a part-time day if the child attended the provider's facility on a virtual learning day. Now, normally, when you select part-time, whether it's standalone or variable schedule scholarship, you can't select more than 2 days. However, if it is a true virtual care day, you can select more than 2 days. Providers may select 1 to 4 part-time days depending on the total virtual learning days. But one caveat is for anything related to our rates and when there's a combination is that we will never pay more than the provider's full-time rate. So if you had a situation where school was closed for 4 days and due to virtual learning, but by the school, then you would be able to select 4 part-time days. However, if that exceeded your full-time rate, you will only receive your full-time rate reimbursement. And then a big thing to remember, you should not bill for virtual care during school holidays and summer breaks. And then the biggest one to remember, you should not be billing for virtual care if the school is closed or that child is not attending your facility on a virtual learning day. So if you know, based on that school system, we have some school systems that still maybe 1 day a week or once a month have a virtual learning day. And if you have a school-age child that attends your facility while they are in that virtual learning setting on that day, then you may claim virtual care. That is only caveat to the virtual care. Okay, next is temporary closure. So this is again a continuation of our CAPS emergency policy. And licensed providers must have reported their temporary closure in Koala. Informal and exempt providers must report closure in Georgia CAPS under the request change menu. Providers may bill for a service week due to temporary closure and will be reimbursed for up to 30 consecutive days. Providers will not be able to submit attendance as temporary closure if the closure dates have not been reported. So in other words, you can't select temporary closure if you have not reported your closure days to Koala or in our system if you're an exempt or informal provider. And also, as in line with the CAPS emergency policy waiver, the child must have been present and in attendance at least once and billed on in your facility in order to receive payment for that child. So if you submitted for temporary closure, but you had 5 children that had never attended your facility before, you would not receive payment for 5 of those children. And then of course, CAPS will reimburse the service week based on the eligible scholarships and the type of care that was available for that selected service week. This is a screenshot from Georgia Caps, if you needed to select temporary closure. So you can see here, in order to bill for temporary closure in Georgia Caps, you would first answer the question, were you open during this service week? And you would answer no. And then it says, is it because you were temporarily closed? If you answer yes, then the system will, and then you go to the bottom of the page, and then you would do your check boxes, and you would hit submit. The system will process that for payment. If you select no, it's not because you're temporarily closed. You are saying that you were closed during this week and you have no CAPS children that you're billing on. And then also, if you were closed for an extended period, remember the policy is only up to 30 consecutive days. So if you're closed longer than that, then you will have to submit a waiver for consideration if any payments would be issued after 30 days. Okay. So just a reminder again about submitting your attendance. As previously discussed, you must both save and submit your attendance. Although you can enter and save attendance daily, the submit button only becomes available at 5 p.m. on Friday. And so one big thing to remember is that if you do not hit the submit button, your request will not be included in the weekly payment process. So in the example, if you submitted it at 5 p.m. on Friday, then it would be included in the next payment cutoff is the following Tuesday at 11 a.m. And then if you are open on the weekends, of course, you would not want to submit your attendance early on Friday. You would wait until, the care that you provided on Saturday and Sunday so that you could submit your final request for payment. All right, viewing your attendance history. So this will be a big one, right? This is different from your remittance, but this is your attendance history. To view that on the attendance tracking dashboard, you'll see a tab that is labeled attendance history. And if you select that, you will be able to see any submitted attendance record that you have submitted and processed. Or if you just have it unsubmitted, right? You've saved attendance, but you haven't submitted it yet. And then one big thing will be, like in the example we're talking about, if you submitted your attendance on Friday at 5 p.m., the next payment cycle does not close until the following Tuesday at 11 a.m. Therefore, up under the action column on the far right, you would see a pencil icon. If that pencil icon is available to you, then you would be able to edit that attendance. If you found out, oh, I think I've marked, this child and this child incorrect, and I didn't reflect that accurately, you can go back into your attendance history, click that pencil icon, and edit that attendance and hit that submit button again and make those adjustments. However, you will not see that pencil icon if it is past the Tuesday 11 a.m. cutoff time. Okay. All right, now we're going to talk about payment request. This is outside of your attendance tracking and regular service week submission. These are payment requests that you need to submit in Georgia Caps because perhaps, attendance was not billed on properly or accurately, or there may be an underpayment, or a child was marked in error. And so you need to submit a payment request in our system. Previously, these requests had to be sent by email or by paper with Maximus. So now they are now digitized in our system so they can be easily tracked, and you all will be able to see the status of those too. But the 4 payment request types are marked no care and error, unbilled service week between 60 to 90 days, missing scholarship, and other payment requests. Now I'm going to high level give you the details to what these mean, but of course you will have this information available to you also on our website. But the first option, marked no care and error, is that you submitted your attendance record for payment and you realized that it's now after the cutoff and you marked a child no care in error and they should have been in attendance. You can submit this payment request for that situation to be reviewed and considered if there needs to be an adjustment made. Then the next one is unbilled service week between 60 to 90 days. You will notice in your attendance tracking, there is a separate section for expired service weeks greater than 60 days. If you did not bill for your service week within 60 days, those service weeks are now expired. However, if you have one that is within 60 to 90 days that you would like to request consideration for, then you will submit this type of payment request, unbilled service week between 60 to 90 days old. The next one is missing scholarship. This one's a little different. It's not reporting a missing scholarship. It is actually to receive payment on a scholarship that was missing. So one thing is that if you find that a scholarship has been corrected and is now available to you in Georgia CAPS, if you have not billed for the applicable service weeks for that child in the attendance tracking, you'll just be able to go in like normal and enter your attendance daily and be able to select that child. So you wouldn't have to submit this request. However, if there was a situation where you were not able to visibly see that child and you already submitted your attendance record for payment, and now this scholarship is available and it was a previous service week, you will be able to go into this section, select that child, what the service week was, and submit that payment request for consideration. And then the last one is other payment requests. Think of this one as a catch-all. If there is an over or underpayment that you need to report, you believe there's an incorrect rate, incorrect tier, incorrect scholarship, or any other reasons that are not defined in the other payment request types, you would submit other payment request. Okay. Then same as the request change feature that's in Georgia CAPS, you will be able to see all payment requests. Again, on that left-hand side where the payments are located, and then within that page, you'll see submitted request. You'll be able to track the status of those, whether they're being reviewed, they're processed, or there may be something where our team may need information back from you. So it may say return to provider and they may have contacted you. It can be various things, but if it's been approved, denied, you'll actually see that status, and our team would also notify you of the final outcome of any requests you submitted. But it's just a great way that you can see historically all these payment requests, and it's not going to be any more of this verbal, I called or I sent an email and you have to provide a history of when you sent an email and the date. We'll actually be able to see that in the system, and so will you. So we'll know what has been submitted. Okay. And just some friendly reminders is that invoices must accurately report attendance within 60 calendar days of services, and weekly submission of attendance is strongly encouraged for timely processing and to reduce the risk of forfeiture of payment. Anything that's greater than 60 days does risk forfeiture of payment, and then any invoices or payment adjustments that are submitted greater than 90 days will not be reimbursed or processed for payment. Okay, the next slide. Following the recent rollout, providers should have received their initial payments via the Georgia CAPS system last week. If you submitted your service weeks by November 21st, so our first cutoff in payment cycle run was on November 21st, and the first payment should have been received between November 29th and December 2nd. So there are some key changes regarding our payment cycle compared to Maximus. So we want to make sure that you are informed and aware of these changes. First, we're going to talk about the invoice submission to payment received. Providers can start submitting their current service week invoice on Friday at 5 p.m. The deadline for that service week submission is the following Tuesday at 11 a.m. And the deadline means if you want it to be in that payment cycle, then you have to submit it by Tuesday at 11 a.m. If it's submitted after Tuesday at 11 a.m., it's going to move to the next payment cycle, which will be the following Tuesday, okay? But you can see here, then that Tuesday through Friday, it goes through a quality assurance review. Not until the following Monday does Decal Finance process the funds. And then on that Wednesday, Maximus begins sending payments to providers. Providers should receive their funds within 1 to 4 days, depending on your banking institution. Okay? So that's kind of walking through high level that cycle. Now we're going to go through an actual week and a timeline to give you a better idea of what this now looks like. So in this example, we're using the service week of November 27th through Sunday, December 3rd, which just happened, right? So you, provider, would have had that submission open to you beginning on Fridays, December 1st at 5 p.m. You could have submitted the service week of November 27th from Friday at 5 until Tuesday, December 5th at 11 a.m. Okay, so just keep that in mind. Now, today is December 6th. The payments are undergoing a quality assurance review between now and Monday, December 11th. And just keep in mind, the quality assurance review is a tool to assist providers in ensuring accurate payments. Okay, then on Monday, December 11th, Decal will begin processing the funds. And then on December 13th, Maximus will begin issuing payments to providers. And providers should receive their payment between December 13th through December 17th. Okay, so you are still being paid weekly, but the difference is how Maximus did. If you, let's say for the service week of November 20th, if you submitted that on November 27th, you, the provider, was accustomed to between that same week, November 29th and December 2nd, you were receiving that payment. However, the difference is that you will see payments weekly, but it's going to be the following week. Like in this example, if you submitted for processing by Tuesday at 5 p.m. Tuesday at 11 a.m. on Tuesday, right? Then it's going to go through its process, and next week you will receive payment for the November 27th service week. So just always think of it as when I submit it, the payment cycle matters, right? And then when I submit it, depending on if it was before or after that Tuesday cutoff, I'm going to receive payment for that service week the next week. Okay. Again, you'll still get weekly payments unless, of course, you didn't submit it weekly. You'll get weekly payments. It's just not going to reflect in the same week as providers were accustomed to. Okay. And then this is again showing you the remittance. So once those funds have been processed, you should now see the remittance statement. And there may be multiple invoices under that remittance if you submitted more than one service week. And the key factor here will be just remembering, like when you look at your attendance tracking history, the date of submission will matter. So if you submitted November 20th service week, let's say on November 27th, then it got picked up on November 28th for the payment run. And so you would have gotten payments that this week, right? For that service week. But if you didn't, and you didn't submit your service week for November 20th until November 29th, the first time it can get picked up in a payment cycle is on Tuesday, December 5th. And so then you wouldn't get paid for it until the following week. So that payment cycle cutoff is not different. That's the same process, the Tuesday cutoff time frame. The difference is that it's just not paying in the same week if you submit it prior to that Tuesday 11 a.m. cutoff. Okay. And then I want to drill down a little further and how you now will be able to see full visibility into your payment details. So as I mentioned, you're going to select your remittance, then you're going to drill down into the invoice number that's available to you. Then once you drill down into that invoice, you are going to see this header at the top with the child details and all these payments per child. So you'll see the child's name, the service week, the base rate, family fee, differential, tier amount, registration fee, and then the amount that was paid to you, the provider. We know that previously in the provider billing portal, you did not necessarily see the accurate base amount or gross pay amount that was paid to you because it still used the state maximum and did not incorporate how payments were being dispersed to providers during access while we were paying the provider's published rate. So I want to break this down a little bit for you guys so you'll understand how to calculate your payment. One, your provider rates are now in Georgia Caps. If you're questioning what your provider rates are, you can now see those in Georgia Caps. They are also in Gateway. So there's no need to send that. A family doesn't have to send it. We keep the rates in the system and you can see what your rates are. But to see the payment details, you first have to understand what these different columns mean and how the addition and subtraction of those occur. So one, the base rate is typically for most payments, depending on a UAS code, the base rate is populated between the lowest state maximum rate and the provider's published rate. Okay. So the state maximums are found on the CAPS reimbursement form that's on our CAPS website. So it's based on type of care, zone as you as a center, right? The age of the child and where that child fits in at. So you would take your base rate and then your differential is known as the difference between the base rates of the state maximum and the provider's published rate. And then of course now, because these are payments after October 2nd, when we have introduced the family fee back to the families, you subtract that fee. Then tier is calculated using the state maximum minus the child fee times your tier percentage if you're eligible for a tier. And then this is how you would get the amount paid. So just real quick in this example, this provider's, the state maximum for this provider and this child was 165. The provider's published rate is 200. So the base rate for this provider is 165. The differential is 165 minus 200, which is 35. So that's what CAPS would pay you for the base total is 200. Then we would subtract the family fee, because in this situation, there was a $20 family fee or child fee. And then to calculate the tier, you're going to use the state maximum reimbursement, which is 165 minus the child fee times the tier percentage. And in this example, it was 35%. Then you can see at the header, as you'll see also in Georgia Caps, the plus minus signs are there to kind of assist you in knowing if you add or subtract the totals. All right. So 200 minus 20, then plus 51 tier is how we get to a final payment of 231. And that's what you should see in the system. Okay. Then last slide, just a reminder, or last slide for me, let me say that. We're almost done. for the family fee. So as a reminder, effective October 2nd, families will resume paying the family fee, and DeKalb will continue to pay the families' remaining tuition costs, which is also including the parents' weekly responsibility. The provider should only collect the family fee if applicable. The family fee can be found on the scholarship details in the system. And in this screenshot example that I'm showing you, you can see there's a separate section that says family fee, and this family fee is zero. So you, provider, would not collect anything from this family. Then you see a separate section that says parent weekly responsibility. Well, right now, because we are still under access, you would not collect anything from this family at all as the provider. CAPS would be paying you. However, if this family did have a family fee, that would display in that section, and you would know that that is what you as the provider would collect from this family. All right, so that is an update and description of our payment cycle processing. I'm going to turn this over to Ann.
Good afternoon, and thank you so much for joining us today. My name is Ann Panzica, and I'm the Education and Outreach Manager for Provider Relations. We're going to go over just a few minutes. I apologize, and if you do need to drop, you are more than welcome to go to our webpage, and we'll have the recording there. We'll also be sending out the recording to all of you this week. So if you do need to drop, don't worry. You can review the parts that you missed, and we'll make sure that we send that to you. I'm going to go over very quickly how to navigate Georgia CAPS. So to access Georgia CAPS, all of you should have received an email, a welcome email. If you've received that email and you'd like to be able to log in, but you're having trouble finding the link, you can go to the portal link that Kay had mentioned earlier, or you can go to our webpage. I'm going to go ahead and put the webpage into the chat. Our webpage has the most up-to-date information regarding our system, regarding our team, regarding provider relations. So if you go to our webpage, then you can find the portal link there as well. It's under the Georgia CAPS portal right there. It's hyperlinked, so you can navigate there. And I'll show you how to be able to save it to your favorites so you can easily access it. Next slide. So you can save the page to your favorites, or you can bookmark it. To be able to do this, you go to the star at the top of the page, and then you save that page to your desired folder. That's a way to easily access the portal. You can also bookmark it as well. It's up to you, but I know for me, I always save to my favorites. It's just an easy way to be able to pull up a page I'm looking for. Next slide. So we're going to talk about how to submit a ticket. So to communicate, we can actually communicate through the Georgia CAPS system. So providers, you can look for updates, requests, and responses on the dashboard. If you look at that bell notification in the portal, that's going to have notifications there. So if it's something that's an emergency, if it's something important, it'll be there in the notifications. And then there's also communications that can be present in the dashboard on the banner. So that's two ways that we can communicate with you through the portal. Next slide. So to create a ticket, you're going to log into the portal. You're going to go to your dashboard, and then on the left side of your screen, there's a button, Log a Ticket. It's under Need Support, and you're going to go ahead and select that. Next slide. And then you're going to complete all the fields. Some of them will be already populated with information. But then when you get to the category, there's a drop-down menu. And you're going to go ahead and choose what the issue is if it's listed there. If it's not, you can select Other. But we recommend that you add as much detail as possible in the description underneath the dropdown so that our vendors who are responsible for the system can understand what the issue is very quickly, and they can try to replicate that issue. So detail is great. We love screenshots, description, and as much detail as possible so that we can have our vendors be able to replicate that issue. Next slide. So then once you've completed all of your information, the category of what it is that you're needing, and then also description, you're going to select Save and Next. and then you'll receive a confirmation at the top of your screen that the ticket has been submitted successfully. So when you are submitting a ticket for an issue, make sure that you're only submitting a ticket once for that issue. Submitting a ticket multiple times for the same issue is not going to it's not going to help us to respond faster. It actually ends up becoming, there's so much volume that it becomes more difficult to navigate through. So if you can just submit one ticket per issue, that's very helpful to us. And we'll make sure that we get to your issue. And then if you want to view your former submissions, you can go to all incidents and you can view your incidents there. So all of the submissions that you previously entered, you can view the status there and see what the status is for your submission. And then the notes, unfortunately, we're not able to add notes at this time, but our vendor is working on that, and they should be able to fix that very soon. So you will be able to see notes regarding that issue that you're submitting. So some best practices. So make sure that you're checking your email, because we are responding through email to all of the emails that we receive. And we've had a very high volume, so we are getting to them as quickly as we can. We have multiple teams working on them and working on the calls as well. The submitting a ticket through Georgia Caps, please make sure that you're logging one ticket for each issue. If there's more than one issue, you can log multiple tickets, but for one issue, please just log one ticket. And that will help us to be able to address your issue faster. Also, make sure that you're bookmarking the Georgia Caps login or you're saving it to your favorites. And please allow 2 business days for a response. So if you're calling, understand that at this time, because of the transition, we've had a very high volume, and your call is extremely important to us, and we will get back to you. And like I said, we have multiple teams that are working together on this to make sure that we're as responsive as we can be. And we just ask that you allow 2 days for a response. So for training and support, next slide. We have our web page that I already linked into the chat, and that web page has the most up-to-date information regarding provider relations. The webinar will be recorded and available there on that page. We also have had a town hall on October 5th. We had one. We're having one now because we saw that there were a lot of questions, and we wanted to make sure that we were addressing them, in this format. And then we're also going to have a survey after as well. And I've seen a lot of messages coming through that chat, and don't worry, we're going to capture all of those messages in the chat, and we're going to provide responses to them. And we're also going to be looking at that survey and reaching out to you either through technical assistance training or through, individually if it's an issue where you require individual technical assistance. But we will be responding to all of the information that you're giving to us in the survey and in the chat box. And we're also going to be scheduling virtual office hours. So to connect you with experts through the phone, through video chats, or through online messages. And so those will be announced on the webpage as well. Next slide. So if you go to our webpage, we have our training videos. Those are the 6 that are there currently. We're going to be adding more, but that can kind of help you get used to the system. They're only about 2 to 3 minutes long. They're very short, and it walks you through with visuals. So for me, I'm a visual learner, so I really appreciate that type of format for learning. So that is available to you on the site. Next slide. User guides. We also have some really great user guides that are there on that webpage also. There's an informal provider guide, there's a licensed provider guide, and exempt. So you can go through there, and that can help you with being able to submit a ticket, help you be able to troubleshoot and to send requests also. There's also informational resources on the site, flyers, the podcast, there's recordings, there's also an FAQ. And we'll be updating those FAQs also. Next slide. So to contact us, you can submit a ticket. We are getting to every issue that you're submitting, so please just make sure that you're submitting one per issue. If you have questions about Georgia CAPS or the provider relations team, you can email us at capsprovidersupport@decal.ga.gov. or you can go to our webpage, and all of that contact information is there as well as our phone number. So it's the CAPS main line, and then it actually prompts you to be able to get to provider relations. So all of that information is on our webpage. And so now we're going to ask you to please go ahead and add any questions that we were not able to address, because we were looking at the most frequently asked questions that have been coming in. So if your question was not addressed as a result of this webinar, please put it into the chat, or you can go ahead and complete that survey. I'm going to put a link here in the chat. And we're also going to be sending you a follow-up email as well. So just to make sure that you're able to get into the webpage and be able to get into the system. So thank you for your time. We know that your time is valuable, and we appreciate everything that you do. And we look forward to speaking with you soon. Have a lovely rest of your day.